Hello and welcome to this week's What Were They Thinking? Among the news items we have for you this week is which kind of immunity is best when we're talking about COVID-19? The interesting issues around the increasing rate of caffeine overdoses leading to death. Further evidence that autism is a neuropathology that occurs in utero before anything else. MRIs to map parts of our brain and how they change over time. And unusual interstellar news. The timestamps for each of these and other news items can be found in the description box below. Let's start with immunity to COVID-19. There is the ongoing argument that natural immunity is better. Somehow or other, people have the odd notion that putting the word natural in front of anything immediately makes it superior to other options. This isn't necessarily the case. For example, there is no difference between synthetically generated vitamin C and naturally occurring vitamin C. This means that as long as you can get it in your body at the right dose, you'll be fine. This is where the question about vaccine-mediated immunity versus naturally gained immunity comes into play. At least as far as theory goes, there should be no practical difference between the two. There are some studies showing that there are benefits to each, and together, natural immunity and vaccine-mediated immunity are superior. This has been termed hybrid immunity. The major study for this was published in The Lancet Infectious Diseases, and it looked at Brazil in particular. Brazil was hard hit, and in fact is perhaps one of the worst hit countries. Their examination found that between getting both a vaccinated individual, a non-vaccinated individual, and an individual who had been infected and vaccinated, there was a significant difference. For example, if you had received the Pfizer and AstraZeneca vaccines, they were 90% effective against hospitalization and death. That's a pretty good number. This is about in line with what you would expect to find. What they found was that once you started accounting for the infection and vaccination, the timeline for having been vaccinated and relatively immune against reinfection extended many months beyond just being vaccinated. This could be anywhere up to 66% reduction in the risk of reinfection and up to protection periods of 20 months. So we're not talking about a drastic difference, but there is certainly a notable difference. There is interesting questions as to why this has occurred, given that the mechanisms for immunity in both cases should be the same. So why natural mediated immunity is providing this extra layer or extra duration of protection is all kinds of unexpected. There is one proposed reason for this, and that could be that when they did this study, they only accounted for 2-dose regimes, that is your initial dose and then your establishing dose of the vaccine. This means no boosters were accounted for. A booster shot may be providing the same functionality as infection. So in theory, if they were to compare this to a 2-dose regime, 2-dose plus booster, and natural immunity, the differences might be significantly more, less, or nothing. Next is an interesting article coming out of the Skeptical Raptor, and it looks at Robert Malone. Robert Malone may be someone you've heard of in recent months, if not the last couple of years, as he made some very bold claims around mRNA vaccines and his role in developing them. Fundamentally, he's used this to create a platform from which he can spread his own particular views around vaccines and other things. In this case, he has made various bold and often questionable claims about the efficacy and safety of mRNA technology-based vaccines. this isn't coming out of nowhere in its entirety, and the article we refer you back to for this does provide much more information. What is worth noting is that yes, he does have a history from working with mRNA in the 1980s, that this was used to lead into mRNA vaccines, but they were not the vaccines themselves, and this is a big caveat. Their claim could be like comparing the creation of the phonograph, or the original, earliest and very first audio recording device, to modern compact discs and MP3 players. The evolution of the two, although serving the same basic purpose and having the same fundamental origin of being able to play audio, has very different modern applications, designs and structures that allow it to do what it does. His work is important to show that you could get mRNA into a cell and be able to have that cell then produce products based on that mRNA. That's the important basis on which his work has led into vaccines. It took a lot more time and effort to be able to develop a means of getting that mRNA into a living person and then have that particular mRNA do its job without being shut down by the immune system before it got anywhere near doing what was needed. And that's where the difference between his work and vaccines come in. He showed the fundamental principle that you could record audio. Somebody else developed a way of taking that idea and making it practical on a large scale. If you want to understand not only where his work fits into the wider picture, some more details on what he actually did, and how a vaccine was developed using mRNA technology, please take a look at the article linked below in the description box. You'll find it's full of much more useful information. Next, we're going to talk about medication and medicine-related products, but this time, the lack of regulation. Where vaccines are heavily regulated and they are strictly controlled, both for quality and efficacy, most supplements and similar aren't. And this is where the death of a British male in 2001 becomes a big factor. They were, unfortunately, poisoned with caffeine. They consumed this when they were buying pure caffeine powder, and that was then added to a beverage. Unfortunately, they weren't calculating how much was in here, and it ultimately led to their untimely death. What they purchased was 100 grams of pure caffeine. Theoretically, your regular cup of coffee has between 30 and 60 milligrams of this in it. Some of your more potent energy drinks and similar stimulants have up to 300 milligrams. He had a 100 gram container and was using this to try and get milligrams. It's not exactly rocket science, but neither is it something you should be trying to just wing. Normally products of this kind come with some sort of pre-established measure. Normally this is, say, a scoop used to take out a reasonably consistent measured amount. This wasn't provided in the packaging, and in fact the coroner, looking at the remains, identified this as a significant problem and something that would have likely avoided his death. And this is where the article we refer you to in the description box below gets to the point that caffeine is, surprisingly, not that well regulated. Admittedly, pure caffeine, such as in the example given, is rare. It's not that unusual to find it in all sorts of other products. For example, energy drinks are perhaps the most common, but then you have things like Coke. There are also instances where it can be used in conjunction with medications that are more pharmaceutically oriented, such as pain relief. All of these are pretty much something that has no regulation around it for the caffeine element. In the case of something like paracetamol, that is regulated. The energy drinks, the sugar content and other labeling is regulated, but the caffeine isn't anywhere near as much. Coca-Cola, the amount of caffeine in there isn't regulated. And this is really important, because we're just talking about things that you might think of immediately, but it can also be found in foods and supplements like pre-workout formulas. Better yet, knowledge around not only conversion between grams and milligrams in the case of the initial example, but overall better regulation around caffeine in foods and drinks would be extremely beneficial. Next we have something that's slightly close to home for a lot of people, and that is autism being detectable in utero, that is, when you're still a developing fetus. Most people will know that children get diagnosed with autism as a young child, often between the ages of 2 and 10, sometimes slightly older and sometimes slightly younger, but in that very broad bracket. That's because at that age, it's when the observable behaviours become apparent. This is also then associated with other events, notably vaccines, which is how there was this erroneous assumption that there was a relationship. That has long since been disproven, especially when it comes to the MMR vaccine. The big question now is, what is causing it and when? Once we understand that, treatments and support can be targeted at the right time and in the right way to support children with autism and minimize the disruption the signs and symptoms bring to their life. This is where the analysis of their brain becomes important. When autism is a neuropathology, we can look at it and be able to diagnose it early on and take action earlier than diagnoses made from behavior and other clinical observations. This sort of research is somewhat more important than the genetics research that goes on. Even if we understand what the genetic cause of autism is at present, that doesn't say we can do anything about it. Looking at the manifestations and identifying it early allows for interventions that are targeted and effective early on. The article we link to below gives not only a good summary of what has been found, where it's been found, but also the controversies that have led to us going down the wrong pathway multiple times, chasing erroneous leads like vaccines. Next is research into genetics, and it's a human genome project that's trying to figure out the most comprehensive genome for humans as is possible. It's generally thought that the vast majority of the DNA in our genome is junk DNA. It does nothing of any importance. It doesn't code for anything, and it doesn't have any regulatory role that we're aware of. The reality is that this perception is changing over time, where it's thought that some of this has a regulatory role, just not in the way we thought it did. For example, long non-coding RNA binding to it and preventing things like transcription from occurring. This is why the human genome is something that needs to be understood, and having a comprehensive analysis done is going to lead to all kinds of investigative pathways that until now haven't been obvious. This is not a small project. Just bear in mind that the very first human genome project took a long time and billions of dollars. So that was a big hassle, and it was a very expensive hassle. This one involved 100 scientists and has done the same job in a much shorter time frame. This is all largely thanks to the availability of much cheaper, faster, and accurate sequencing technology. That's allowed the researchers involved to be able to find thousands of errors in past genome projects and be able to correct the referencing that we have available. For those who need to see an example, you can go to PubMed and find specific genes, which nucleotides make up that gene in what sequence, and be able to create products for genetic research from this. That means that we can get better binding of things like primers to certain genes and be able to amplify them more accurately. This is a really big thing that we need to talk about as far as the accuracy of future genetic research goes. Moving on to the topic of the human brain rather than the human genome. The human brain changes a lot over your life. The reality is that when you are first born, your brain is a small squishy walnut encased in partial bone that freely moves so that you can be born into the world. As you get older, the skull hardens, the brain solidifies somewhat, and it becomes more active, growing during your early childhood years. After a certain time, that growth stops, and your brain will remain relatively stationary for the next few decades. After this, it begins to decline, with parts beginning to shrink and others deteriorating. This is why we see an increase in incidences of neuropathologies in the elderly. To understand what happens from birth to death, 100,000 MRIs were used to map its development and change. Well, more than 100,000, it was 123,984 scans. These came from a little over 100,450 odd individuals. That is 16-week-old fetuses to a 100-year-old adult. That is pretty much the entire gamete of the human species as far as the relevant and useful information goes. The usefulness of this information, and especially the standardization of the information, is especially important when we're talking about trying to understand what's going on in the brain and being able to demonstrate what those changes are, where they occur, and then allow us to then hypothesize as to why they occur. This has also meant that some prior theories can be better supported, or they can be rejected based on available information. Going back to drugs for a short time, but specifically focusing on illicit drugs this time. Illicit drugs are increasingly being laced with fentanyl. Fentanyl is a rather useful drug in certain circumstances, especially for pain management. By using fentanyl, they are better able to deal with their problems and have a relatively fulfilling life. The problem is when this is used illicitly or added to illicit drugs in the form of pills to increase their addiction. Between 2018 and 2021, there has been nearly a double in the number of cases of pills laced with fentanyl. That's a huge increase, and that's a big problem. Fentanyl is very potent, and so even a small amount can have a big effect. For example, it can cause death. If not death, it can increase the addictive properties of the drug it's being put into. The problem with fentanyl is where it sits between being lethal and being therapeutic. It only takes a couple of milligrams to kill. And that's the problem. It only takes a little bit under a couple of milligrams to be pain relief. This is the problem. It is extremely potent, both as its therapeutic dose and as a lethal dose, and they are very similar numbers, which means when you begin to adulterate other drugs with it, or lace those drugs with it, it becomes very effective at getting someone hooked on that drug, but it can also very easily kill. Drugs like this, and unfortunately the effects they have on the population, may be what prevents us from colonizing Mars. One reason we might not want to colonize Mars anyway is the unusual quakes that are going on under its surface at the moment. This isn't something necessarily new. Mars has had earthquakes before, as much as obvious from the fact that it has mountain ranges on it. The problem is, we don't know quite what's causing this, and these were previously undetected earthquakes, or should they be called marsquakes? The quakes that are being experienced on Mars are a sign that the planet is nowhere near as dead as we've thought it to be. The ongoing theory has been that Mars is, for all intents and purposes, a dead planet with a broken core. This would be why there's been theories about jump-starting it with atomic weapons. That might not be necessary if the plates are continuing to move, and the core and the magma around it are still molten. This would mean that the planet simply needs to have a new atmosphere generated and be able to sustain life, preferably by itself. Finally, something for those who believe in Martians, it's the detection of a space laser, and it's coming from deep space. Most people would know to some extent that we've been putting out radio signals into space for the last 100 and some years. This has been a signal that will keep going out into space, and it's thought that it's possible one day aliens may try and trace back that signal to Earth. If that doesn't work, we might experience what we are now, where instead of them detecting our signal, we detect theirs. In this case, it is a radio signal detected from 5 billion light years away from Earth. It had to be detected using a very large, very powerful telescope called the Meerkat telescope found in South Africa. What they detected is a radio wavelength laser light. Fundamentally, all we're talking about here is a radio wavelength. And for most purposes, that's good enough for this video. What this means is that it's possible that there's something emitting this particular wavelength from 5 billion light years away, and we could trace it back to try and find its origin. That's what the researchers did, and unfortunately what they found at the far end was not aliens. Rather, they found the impact of two galaxies coming together. This is slightly technical, and to make it simple, what happens when the two galaxies come together is that they cause the emission of the same signal we're seeing. However, due to the nature of what it is, it's supposed to be produced at a shorter wavelength of 18 centimeters. The problem is the redshifting, or expansion of the universe, causes the wavelength detected at our end of it to be 21 centimeters, and this is how they can tell it apart. 21 centimeters is in range for it to be understood the way it has been. Once they've adjusted for that, and tracing it back to its origin, they could figure out exactly what it was. It is two galaxies crashing together. That's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.